Assalamualaikum, I am Fakhira Hanim Binti Muhammad Dzohri from Bachelor of Science in Biology from UiTM Perlis. My supervisor name is Dr. Muhammad Akmal bin Hashim. My title for final year project is an investigation on anti-inflammatory and antibacterial activity of Chromolena odorata. In this video, I would like to explain about introduction, literature review, methodology, result and discussion, conclusion and recommendation, and lastly, preferences. Chromolena odorata is under the Compositae or Asteraceae family that is usually used as traditional medicine, herbaceous in healing minor wounds. C. odorata leaf extract have been reported to have antioxidant, anti-inflammatory, analgesic, antimicrobial, cytoprotective, and a variety of other medicinal significant properties. Obviously, C. odorata exhibit antimicrobial activity against several pathogens associated with diarrhea, skin infection, wound infection, urinary tract infection, and food contamination. A theoretical issue that has dominated the field for many years is the rising microbial drug resistance. So, there has been a study for alternative antimicrobial treatment derived from natural plant sources. Besides, the controversy over synthetic drugs has raged for many years. This is due to the synthetic drugs having their side effect on health in the short term or long term, especially for certain individuals that are not suitable for this kind of medicine. It can give side effects such as skin rash or dermatitis. Next, the significance of the study is to reaffirm the potential of Chromolena odorata leaf extract as anti-inflammatory and antimicrobial agent, and also to identify the compound from C. odorata leaf extract that may contribute to the potent bioactivities. The objective of this study is to determine the anti-inflammatory activity of Chromolena odorata leaf extract, to evaluate the antibacterial activity of C. odorata leaf extract, and to identify the phytochemical constituents in C. odorata leaf extracts. According to Jasny 2009, Chromolena odorata is mostly called as pokok kapal terbang, pokok Jerman, pokok Jepun, and pokok Siam in Malaysia. This plant has a short life cycle up to 10 years and grows to a height of 2 meters according to Zahara 2009. Aziz et al. 2020 evaluate that this plant can thrive in a variety of soil pH level but best in acidic soil. Antibacterial are agents that have a static or concerning impact on the viability of microorganisms. Kitchener and Chioma 2020 reported that ethanol and chloroform extract of C. odorata by maceration method against methicillin-resistant S. aureus (MRSA) to analyze the antibacterial effect. The maceration method and agar well diffusion technique was used. Ethanol extract show higher inhibition than chloroform extract. Vijaya Raghavan et al. 2018 evaluated the maceration technique to test the same ethanol and aqueous extract against P. aeruginosa, S. aureus, B. subtilis, E. coli, and B. cereus. The ethanolic leaf extract show higher antibacterial properties than the aqueous extract. Inflammation is necessary immunological reaction that serves as a defense mechanism against tissue damage caused by pathogens, injury, and other hazardous situations. In this literature review, Ilion et al. 2018 investigate the possible mechanism of anti-inflammatory effect in rats by injecting histamine, serotonin, and arachidonic acid into the plantar aponeurosis, which was used to induce bowel edema. An aqueous extract of C. odorata leaf was formed using the decoction method. According to the finding, C. odorata aqueous extract, which are 400 and 800 mg per kg, reduce histamine, serotonin, and arachidonic acid inflammation. Haija et al. 2017 reported that the ethanolic extract cream of C. odorata leaf by using maceration method demonstrated its ability to suppress inflammation tests on mice. The cream show anti-inflammatory activity by reducing edema and leukocyte cell migration. There are several phytochemical components of Chromolena odorata. There are a few structures of flavonoids such as quercetin 7-methyl ether, scutellarin tetramethyl ether, quercetin, luteolin, and camphorol 4-methyl ether. So, this is the chemical structure for alkaloid, terpenoid, and saponin in Chromolena odorata leaf. For methodology of antibacterial test, leaf extraction was prepared by maceration method. Next, Muller-Hinton-Agar (MHA) and nutrient broth was prepared. The bacterial culture that was used is E. coli and B. licheniformis. Next, this diffusion method was used for antibacterial tests and the dimeter inhibition zone was measured in millimeter. Next, for anti-inflammatory test solution extract and standard solution diclofenac sodium was prepared with different concentration. All test tube was incubated around 30 degrees Celsius around 5 minutes. Heated with water bath with 70 degrees Celsius around 5 minutes. The test tube was cooling at room temperature for 50 minutes. Next, the absorbance was measured using a spectrophotometer at 660 nanometer. Percentage of inhibition was calculated using formula which is percentage inhibition equal to Vc minus Vt divided by Vc times 200. Qualitative of the phytochemical test for flavonoid, saponin, alkaloid, and terpenoid was conducted as shown in this slide. According to the result obtained from this diffusion method, antibacterial activity of C. odorata leaf 95% ethanolic extract at 12.5 mg per ml show the highest effect against E. coli with zone of inhibition 11 mm, while at concentration 50 and 25 mg per ml show the lowest zone of inhibition which is 10 mm. C. odorata leaf extract by 95% ethanol at 50 mg per ml show the highest antibacterial activity against B. licheniformis with zone of inhibition 13 mm followed by 25 mg per ml which is 10 mm and 12.5 mg per ml which is 9 mm. This is the lowered one. However, this result showed that ampicillin was very susceptible against E. coli compared to B. lichen. 70% ethanol extract of C. odorata leaf show the highest effect against E. coli with zone of inhibition equal to 11 mm for both concentration of 50 and 25 mg per ml, while the lowest antibacterial activity is 12.5 mg per ml with zone of inhibition 9 mm. 70% ethanol extract show the highest inhibition against B. licheniformis for the concentration of 25 mg per ml, which is 19 mm of zone of inhibition, while at 12.5 mg per ml show the lowest inhibition zone, which is 8 mm. However, these results show that ampicillin was very susceptible to E. coli compared to B. licheniformis. From the table shown in the slide before, it can conclude the antibacterial effect of 70% ethanolic extract of C. odorata leaf are susceptible against B. licheniformis at concentration 25 mg per ml with zone of inhibition 19 mm, while for 95% ethanol extract was only an intermediate range at concentration 50 mg per ml with zone of inhibition 13 mm. It shows the different antibacterial effect of 70% of ethanol extract against E. coli and B. licheniformis, which is the extract is very effective against gram-positive, which is B. licheniformis, then gram-negative, which is E. coli. 95% and 70% ethanolic extract of C. odorata had an anti-inflammatory effect of protein denaturation at all concentration but different percentage of inhibition. From the result, it was shown that 70% ethanol extract of Cromolena odorata leaf was more effective than 95% ethanol extract of C. odorata leaf, since the percentage inhibition of denaturation for 70% was higher at all concentration. However, this activity was not as great as the anti-inflammatory activity of diclofenac sodium. Even though the sample extract have lower anti-inflammatory activity compared to the standard, it still has the potential as an anti-inflammatory agent, since there is only a slightly difference between 70% ethanol extract at a concentration 1 mg per ml with 69.11 plus minus 0.002%. Cromolena odorata leaf tested positive for flavonoid, alkaloid, terpenoid, and saponin tests. However, there is fairly presence of flavonoid in Cromolena odorata extract compared to the other tests. Alkaloid was highly present in this plant extract since it has clearly white precipitate on top. This extract contains a high amount of saponin when the bubble form is present, and it was stable in a few minutes. Further, the high presence of terpenoid was also evidenced due to the ring formation at the interface. According to Negosi et al. 2021, phytochemical constituents such as flavonoid and saponin could be responsible for the anti-inflammatory and antibacterial activity of the plant. This study was performed to enhance the research of the natural anti-inflammatory and antibacterial sources of the synthetic drug. The phytochemical constituent can be strong evidence of the potential of Cromolena odorata extract that acts as antibacterial and anti-inflammatory due to the presence of flavonoid, alkaloid, terpenoid, and saponin. 70% ethanol extract has the potential to be natural antibacterial activity compared to 95% ethanol extract of Cromolena odorata and positive control. 70% ethanol extract of Cromolena odorata has the potential to be natural anti-inflammatory activity. For recommendation, using other gram-positive and negative bacteria using agar well diffusion method, the amount of bacterial culture broth that was transferred on the agar plate should be reduced. And lastly, increase the concentration of the ethanol extract.